Hi, and welcome to Addictive Behavior and Drugs.
How many people have used a type of drug, think that they have, or know someone who has? I'm pretty sure that everyone can answer yes to any of those three questions, including.
But what are drugs? Drugs are a chemical substance that affects the way you feel and function. They can be swallowed, inhaled, or injected. And they can be used in many different ways that are wrong. For example, drug abuse, which is a pattern of substance use resulting in harmful consequences. Or drug misuse, which is taking drugs for reasons other than what it was intended for. And drug diversion, giving a prescribed medication to another person. And drug dependence, a pattern of continuing substance abuse despite mental, behavioral, and physical symptoms. Let's start off with commonly used drugs, one of which is caffeine, which mostly everyone has taken. Caffeine is the world's most widely used psychoactive drug. 85% of Americans eat and drink caffeine. Americans on average drink 3.5 cups of caffeine in their beverages daily. Caffeine is a stimulant, so it affects people's minds and behavior. Caffeine can relieve drowsiness, improve memory up to 14 hours, increase alertness, and can protect against depressive moods and even sharpen concentration. However, caffeine won't cause any severe health effects like cancer and a faster heart rate like most people assume. But genes can also determine how addictive caffeine can be. Unfortunately, because doctors recommend less than 500 milligrams a day and even fewer for people with high blood pressure and heart problems, having around 250 milligrams can increase the risk of caffeine intoxication. Caffeine intoxication can deal with restlessness, nervousness, excitement, irregular heart rate. Unfortunately, because doctors recommend less than 500 milligrams a day and even fewer for people with high blood pressure and heart disease, having around 250 milligrams can increase the risk of caffeine intoxication. Caffeine intoxication includes restlessness, nervousness, excitement, irregular heart rate, and even muscle twitching. People may even experience kidney injuries, strokes, or heart attacks from the caffeine intoxication. You can withdraw from caffeine, but caffeine withdrawal may occur if people don't gradually reduce their caffeine intake, so you have to be slow. The diagram on the right shows just how much caffeine our drinks that we drink typically on a daily basis have. You can see the energy drinks like Red Line Power Rush have over 1,000 milligrams of caffeine in just 12 ounces. Moving on to how medications are misused, about 50% of patients take the wrong medications or dosages at the bad times or in completely wrong ways. Annually, 125,000 deaths are caused by these factors. Doctors contribute to these factors because they either omit info about prescriptions to their patients, they don't give the correct dosages, or they may not know about a patient's allergy when they give the patient their medication. The picture on the upper right-hand corner can show all the ways to make sure that you're not misreading your medication and that you're taking it appropriately at the right times and with the right amount. Drugs can be also used in the wrong way depending how a person interacts with drugs and how they put them together. Over-the-counter drugs and prescription drugs mixed together may cause impairments like drowsiness. Even what you eat while taking certain drugs can change how the body is affected by them. Drug interactions can be avoided by checking the labels on how to take the medication and what it can be taken with. Not drinking certain things at specific temperatures with medication can also help. And just making sure that the labels are read on the medication to see how long a person needs to wait to eat or drink after consuming the medicine may help with impairments. Switching over to over-the-counter drugs, which are often used the wrong way because people are misinformed on how to use them correctly. Painkillers like Advil, aspirin, Aleve, and Tylenol may cause stomach irritation and bleeding. There are also risks to the heart and skin. So, for example, if a person isn't feeling well and they are not reading their medication correctly, then they might be taking way too many than they need to, and it will lead to all these health issues. And even nasal sprays can shrink blood vessels, When people use them frequently, the vessels will expand, and then people will continue to get irritated and feel the side effects that are being caused over and over again by the constant usage. The problem with the blood vessels may cause bleeding, infections, and a loss of smell. College students may forget to take medicine as prescribed, and others may not take it on the right schedule or with the right amount because it's too expensive, so they don't want to run out too quickly. Others may stop taking prescriptions when they think that their illness subsides. 70% of adults don't understand what dosage to take for their medication, and 30% of others can't read the prescription labels. Unfortunately, by taking the wrong medication, it may cause recurring infections and other serious complications that will need hospital treatment. To continue prescription drug abuse on campuses, people between the ages of 18 and 25 have seen the highest use of prescription medicine not being used for medicinal purposes. 12% of college students use non-prescribed medication like stimulants and painkillers. Men abuse more prescription drugs than women. White and Hispanics are more likely to abuse drugs than blacks and Asians. Marijuana is the only drug used more than prescription medication. Students who abuse prescriptions are prone to participate in binge drinking and other drug usage. And not only does this show how drugs can be abused on campus, but this also is a clear example of drug diversion. As seen on the right, the graph shows that most people in college have used stimulants in the past 12 months, and it's 6% in males and only 5% in females. Some more information about stimulants are that they are most commonly misused with college students. About 6% of college students have reported to have misused stimulants. The most common are Adderall, Benzodrine, and Ritalin. Young adults get their prescriptions like ADHD medicine from their friends. Students can take them to improve their grades, or they just want to get the feeling of being high. Short-term side effects can include an increased alertness and energy, as well as increased blood pressure, heart rate, and blood sugar. Long-term effects can include heart problems, paranoia, risky behaviors, and psychosis. And around 2 million people abuse prescription painkillers such as codeine, Oxycontin, Persodan, and Percocets, which are common painkillers that are used. Painkillers are used the most by students in fraternities and sororities, and also who are under a lot of academic stress. Other commonly abused drugs include cannabinoids, herbal drugs, club drugs, stimulants, dissociative drugs, hallucinogens, and opioids, which we're all about to discuss right now. Marijuana comes from a cannabis plant, and hashish is a stronger version of the marijuana. Over 100 million Americans have used marijuana in their lifetime, and marijuana is the third most popular drug in the U.S. More than 1 million out of 12 million Americans who use marijuana cannot control their usage. Cannabidiol, or CBD, is also known as pot, Mary Jane, hash, weed, or blunt, and is the second most abundant cannabinoid in cannabis. CBD can be smoked, eaten, or used in cosmetics. It can also be used to treat epilepsy. It makes users feel euphoric or dreamy. It can cause bloodshot eyes, increased appetite, and impaired motor skills. Herbal drugs, which include saliva or managing mint, is an herb that can be drunken, eaten, or smoked that causes hallucinations. Saliva can be chewed or drunk, and they also cause hallucinations and mood swings. Another example is khat or katha, which is a shrub that can be chewed and makes people energized, but may also cause hallucinations and paranoia. Hallucinogens cause strange and vivid thoughts and feelings. Fortunately, people aren't as dependent on this drug because it's used occasionally. People aren't going to use this type of thing every day. It's more of used recreationally for fun. An example of this is LSD, which is ingested and may cause disordered perception, flashbacks, or visual disturbances. Synthetic designer drugs are unregulated psychoactive substances that are made out of bath salts, plant food, insecticides, and other toxic chemicals. Synthetic marijuana may contain plant material and chemicals that cause even more intense reactions than regular weed. but they can cause seizures, hallucinations, or even heart attacks. Another example is synthetic cathinone, also known as bath salts, which are found in the cat plant. They're generally used in men between the ages of 20 and 30. They can be inhaled, swallowed, and injected. They cause alertness, paranoia, cloudy thinking, suicidal thoughts, and violent behavior. I've actually heard of a few cases where men have been on bath salts and have killed their entire families, so it's a very dangerous drug. Dissociative drugs like PCP and ketamine distort perceptions of sight and sound and detachment from reality. They can alter the distribution of glutamate, a neurotransmitter that involves perception, pain, and memory. Another example is ketamine, or Special K, which is used in veterinarians for their anesthetics. They can become actually addictive and create out-of-body experiences. They are also used as a date rape drug. Other abuse drugs include club drugs like MDMA, GHB, GBL, ketamine, fentanyl, and many other drugs. They're most popular in nightclubs and rave dances because they enhance social interaction so people can party harder and party longer, probably. They cause sweating, blurry vision, and a lot of confusion. An example is MSMA ecstasy, which increases dopamine, which makes you happier, and serotonin, which as well makes you happier. They are used by people commonly between the ages of 18 to 30, which they can be snorted, injected, or ingested with a tablet. They are more deadly to healthy and young people than other drugs. And just to go back on stimulants again, they are drugs that relieve drowsiness and improve the ability to work because they increase motor skills and mental alertness. Examples are amphetamines, methamphetamine, caffeine, or cocaine. Amphetamines are ingested or injected, and they can make users feel really restless or violent. Methamphetamine is snorted or ingested and can cause really aggressive behavior. If you look at the top right picture, you can see just how bad as well these drugs can be to a person's physical health as well. You can see how they can decay teeth. And lastly, there are depressants, which they can depress the central nervous system, and they reduce activity, they cause drowsiness. Examples can include barbiturates, opioids, and alcohol, which they all can relieve tension and help with anxiety. Specifically, barbiturates are used to treat epileptic seizures and can be used for anesthetic purposes. Both may contain dizziness, blackouts, or poor coordination, and benzodiazepines relieve tension and help with anxiety specifically.